Sleep apnea is a medical respiratory disorder occurring during sleeping as the airway is blocked because of the patient's neck or throat anatomy, medical or lifestyle conditions. Some symptoms are snoring, sleepwalking, daytime sleepiness, irritability, difficulty concentrating, morning headaches, etc. According to statistics, approximately 22 million Americans and between 1 to 5% of children are suffering from obstructive sleep apnea, with many being undiagnosed. Health and lifestyle complications resulting from sleep apnea are cardiovascular diseases, heart attacks, and strokes because the body is deprived of normal levels of oxygen and can increase stress on person's relationship with significant other, reduce time reaction in unpredictable situations, decrease work performance, etc. Based on their design and function, there are different types, such as moving the mandibular jaw forward, opening the airway, called mandibular advancement devices or MADs, classified as over-the-counter non-adjustable devices, one-piece or two-piece custom-designed adjustable advancement devices, moving the tongue forward to free the blocked airway, called tongue-retaining devices, which are monoblock, and the most complex appliance is a combination of MAD and CPAP machine, resulting in lowering the air pressure, make it more comfortable for the patient. These appliances can be customized for patients suffering from bruxism, patients presenting a lateral shift, patients wearing removable partial dentures, and for patients that have edentulous arches. The dental appliances can be fabricated by using the traditional and or the digital manufacturing processes where the impressions and bite registration in mandibular protrusion are used to fabricate the customized appliance. The material used are vacuum form materials, different type of acrylics, nylons, 3D printing resins, PMMA, and casted or prefabricated metal attachments. These appliances must have the Food and Drug Administration 510K Class 2 approval because they come in contact with patient's body. In conclusion, the versatility of the design and manufacturing process from simple to more complex dental appliances for sleep apnea using materials that are biocompatible promotes the improvement of patients' health and well-being.